Well, one of them is you can also have, beyond just weakness, you can have actually that spasm that we talked about where there's actually almost either a muscle imbalance or the pelvic floor is too active. And so then there's this incontinence because of that spasticity and because of that overactivity. And that's what we see a lot in athletes or in weightlifters. Either there's a core imbalance and their core is overpowering their pelvic floor. So they might not have a weak pelvic floor, but it's just not balanced with the core and that balance.
So, I mean, there is a time and place for Kegels, but there also can be, just like any other part of the body, some soft tissue work, scar tissue massage, trying to reduce tension within it, functional retraining. So trying to get back to normal activities. I mean, even retraining your brain because it got so used to a certain way of being. So there are bladder diaries that you can do to try and figure out what triggers you for different activities, what diet or anything like that. Functional retraining, respiratory training, things like that, trying to get your whole body working together and not just focusing on one aspect of it and kind of getting the whole picture to work as one cohesive unit.
Yeah, I think breathing and relaxation is a huge thing, especially with that overactivity, just getting pelvic floor to relax. And
it's with all our clients.
Yeah.
More often people always think about just strengthening a muscle, but more often we are trying to work on movement patterns and the coordination of the muscles, and certain muscles have to relax. So I spend more time getting a muscle to inhibit, which means that you're just getting it to shut down a little bit so that they can function more normally.
The education component can be huge too. If you can understand what's going on with it, it's much easier to be able to work on it and address it within yourself. So that way it's not just having to rely on a PT to tell you what to do, but having that understanding and that body awareness to be able to address it going forward.